Unshelling Medicine podcast. Healthcare in the language we understand.
Hello, everybody. Welcome to another great episode. I have the pleasure of having Dr. Victoria with us. Hi, Dr. Victoria. How are you doing today?
I'm good. How are you?
I'm doing very well. Thank you for asking. So today we are discussing a topic that is very near and dear to both of us, given that we're women, right? So we're going to discuss the disparity that primarily affects women in the healthcare space. And Dr. Victoria is well versed in that. You know, she's still practicing and she sees this on a daily basis. And she has a business that caters to women and the disparities that comes with being a woman in the healthcare space. So Dr. Victoria, very excited to talk about, excited, not so excited, because excited, yes, we are disseminating information and education. Not so excited because it still exists today in healthcare. So please tell our audience about yourself and, let's jump into the conversation.
Okay, great. So I'm Dr. Victoria Andarcia. I'm trained in internal medicine, and I also did fellowship in integrative medicine, and I've done some studying with functional medicine. I started that journey because I wasn't fulfilled with the traditional internal medicine model. Like, I was working in the hospital, and while I really liked the hospital because it's like fast paced, I didn't really feel like I was making a difference in people's, like a long lasting difference. I felt like I was more putting out fires and these people would go home and then just come back into the hospital. And it wasn't really how I had envisioned that I would practice medicine. And when I started integrative and functional medicine, I didn't know what avenue I was going to go into until, I decided after 10 years of being on the birth control pill that I was going to come off of the birth control pill. And when I came off, I had horrible symptoms. And I know that doesn't happen to everybody, but, like my hair was falling out. I was extremely tired, like so tired. I just wanted to sleep all the time. And I had acne like I did when I was a teenager. And I'm like, okay, like I'm in my 30s. Why do I have acne again? And then it was nothing I could find information about, like how to come off the birth control. It was like not a thing. But then we know that when you're on birth control, there's certain vitamins and nutrients that are depleted by the pill, specifically like zinc and some B vitamins. And that's, stuff that you need for energy and overall health. So I started like diving deep into women's hormones so that I could help myself. And I realized, as a physician, if it was so hard for me to get the information that I needed, what does someone do if they're not in the medical field? So that's when I decided to work with women. And what's crazy, just last week, I had a conversation with a woman who started having hot flashes. And I kid you not, her doctor said, "You're probably sleeping with too many blankets." Like he said that. But I see it all the time where like women who are tired and they have no motivation to get out of bed. And the doctor's like, "Well, you're getting older. It is what it is. But like, you shouldn't have to struggle to get out of bed." Or weight gain. Weight gain is a really common one. And people are just like, well, that's part of aging. It's common, but it's not normal and it doesn't have to be. And so like women go to the doctor for like these frustrations and they're just being told like it's a normal part of aging, but it's not. And so that's why I work with women around like hormones, especially, I do perimenopause and menopause, which I love because I feel like there's a lot that you can do and quickly when it comes to making changes on that end. But I've also worked with women in fertility. And what I think is missing there, and I feel like in 5 or 10 years, we're going to realize, is that we're jumping into IVF too quickly. Because I've had patients who come to me they're doing IVF or before they start IVF, and it's just like lifestyle and or nutritional deficiencies. Like we know that certain nutritional deficiencies affect your pregnancy, but those are not tested. Like when you go to the doctor, they're not testing for those nutritional deficiencies. I had a woman who came to me last year, 3 miscarriages, and she went to the gynecologist, she went to her primary care, and they said, "Oh, like it was in the first trimester. It's common." But can you imagine the emotional toll it takes to have 3 miscarriages? And then we like looked at her nutrition profile. She was deficient, specifically in iron was one of the deficiencies that she had. So we worked on that. We worked on some lifestyle stuff because she had a lot of stress with her job. She's 38 weeks pregnant now. Yeah. Right. And so you think like she kept going to her doctors and her doctors were like, it's normal in the first trimester. Three miscarriages is not really normal. So, that's why I love what I do, because I just think that there's always more that you can do to improve your health. And unfortunately, the way that the system is set up, if there's not a pill for it, then you're not exactly going to get the solution that you're looking for.
So you said something that is so important, and I'm hoping everybody honed in on that. There's normal and there's common, right? A
Mm-hmm.
lot of the times in medicine today, common is classified as normal, right? Especially when it comes to women's health, especially when it comes to hormonal imbalances in women's health. We're very industrialized. We were not meant to be this industrialized. However, nobody's taking into account the effect of the environment, the effect of lifestyle, the effect of everyday stresses, the effect of career, right?
Mm-hmm.
On our metabolic makeup, right? Because when we talk about hormone imbalances, that's all metabolism, right? So your endocrine exocrine system, it's just one of those things, right? So for somebody, you talked about IVF, for somebody who has gone through that route, the one time anybody paid attention to my thyroid was when I was going through the process of, transfer, right? Because we have to get your thyroid hormones at this certain level. I was never on Synthroid before that, right? So it's just so that it fits into this mode of treatment. So what should women do given that, it is now become kind of like ingrained in us because we do trust them on the healthcare system. It has a lot of advantages, right? But how should we, as women, advocate for ourselves in those scenario where we question, is it normal or is it common? Like, because genetics will make it normal or, familial in nature, I should say, right?
Mm-hmm.
Commonality will come from lifestyle, environment, society, your immediate geographical area in a sense, right? So what would you tell women to do in order to, be educated about normal versus common?
One of the first things I'll say, because I see it with my patients, is a lot of times I'm one of the last people they go to, and it's because they tell me it just doesn't feel right. Okay, so the first thing I'm going to say is that you got to listen to your gut, because if something's going on with you and it doesn't feel right and you feel like you're getting dismissed by your provider, that's valid, right? So I think that instead of just accepting it, you can go a holistic route. There's a lot, like you can try acupuncture, traditional Chinese medicine, Ayurveda, or if you go to the Institute of Functional Medicine or the Integrative Medicine websites, you can find practitioners that have the integrative and the functional medicine training so that you can have that conversation. I do also find that some primary care doctors are kind of coming around, and I think that I've had patients who can have conversations with their primary care doctor. So I would say just try it out, but I think you got to ask for it, right? Like if you said like, hey, like I would like a full thyroid panel, not just your TSH, because that doesn't really tell you a lot. Like some doctors are willing to order that for you, but you've got to ask, unfortunately. And, if they're not able to do that for whatever reason, then you can seek like alternative routes. But I think it always happens with conversation. And you said something that I also agree with. It's that a lot of patients will just accept what they're being told. But your doctor, they might have a lot of things on their mind. It's a very stressful job, and they might not fully be like thinking about all the things that you need. They're just on autopilot, right? And they know like I order this every time I see this patient, and I do this every time I see this patient. But if you just like stopped them and said like, hey, like I actually don't feel okay, and like if we can order more labs or if you can direct me in a way to go, I think most doctors are willing to listen and help. Even if they don't know, they might say like, okay, like, why don't you try this? I just think that we don't ask enough.
We don't, and that stems from, the only term that comes to mind is reverence. That stems from our natural reverence of a doctor in a position of authority who went to medical school, has all this knowledge. I don't want to question this person's knowledge, right? And on the flip side of that, what most people don't know or don't understand is that your doctor depends on you to tell them how you feel. to treat you. They really want to have that conversation. I'm not talking about go to Google and Google something and come in and quiz your doctor about it. It's not a challenge. I mean, just ask, have a normal conversation, right? And you're right. Most doctors are coming around when it comes to holistic medicine, right? It's often termed alternative medicine, whatever it is. But most doctors are now coming around in including that in their patients' plan of care, right? Okay, so we've done this, we've done that, we've done this, okay? Acupuncture, this, even Reiki, right? I've seen doctors include that in medical notes, right?
Yeah.
So being that you're practicing, right, you're very much still practicing, do you find that your colleagues are more, I'll preface this by saying, I've been delightfully surprised that those older doctors who we term as set in their ways, actually the flexible ones, that there's some that are very stuck. I've seen a lot of them be more flexible with, the inclusion of holistic medicine. So in your experience, do you find that the younger generation of doctors are more flexible than the older, almost retired generation of doctors?
Well, my colleagues, I would say yes. I went to residency at FAU in Boca, Florida, and I think I brought that to like the residency. I was very vocal about like your well-being, stress management, because it was not something that we had in residency. And I was very vocal about wanting to do integrative medicine. And I'll say that like my colleagues were probably skeptical, but very open-minded. Okay. And now when I talk to them about like the patient cases that I've had, they're like, oh my gosh, like, I can't believe that you accomplished that or that happened with that patient. And so now like they're more into it and like they read more about it. So I would say, yes, they tend to be more open-minded, but I also think that it might depend on location because I've practiced a lot. I practice in Florida, I've practiced in Kentucky and Arkansas. And I would say that location kind of matters because if I brought any Reiki into the hospital in Kentucky, they'd probably be like, what is this lady doing? So I think, the location matters.
You're right. And what flashed in my head, it may not be appropriate, but the only thing I could think of is like burn at the stake, is witchcraft.
Yeah. Yeah.
People still do have that. I refuse to call it tradition because it's not. The fear of the unknown, the woo-woo rising of things. Oh, woo-woo, I don't understand it, is evil. You are right. In the bigger cities, like, on the East Coast, West Coast, and maybe some part of the middle up there is widely accepted, right? As opposed to the southern states where I would say the heavy Bible Belt, I should say. But so I'm kind of like interested to know, with you being a resident, like, advocating for holistic practices in healthcare, did you have any attending like pushback, or did you at least have them give you audience?
That's very interesting that you say that because my favorite attending in residency, when I told him what I wanted to do, he said, "You're too smart for that. You're just like basically a wasted doctor." And I was just like, oh, okay. But then if he knew like all the things that I've been able to help with people with, he'd be like, oh, wow. I just think that some people get stuck in like, where are the studies? I need to see the meta-analysis. And I mean, now we actually do have studies to validate some of the practices in integrative medicine, but because it's not widespread, people, might be a little bit closed off. But I do remember that, for the most part, I would say a lot of people didn't know what integrative medicine was, but they were curious, like, oh, what is that? Can you explain it to me? Most people were interested in what I had to say, but some people were like, why would you do that? Like, who does that? But now I think that it's a lot more common, and it's just more and more, practices are coming up that are integrative and functional medicine, because you do, not always, unfortunately, not always do you have results, but I've been able to get really good results by like doing some of the practices. And, something to mention too, is that I'm not doing anything crazy. A lot of the things stem from lifestyle, right? But how many times have you gone to the doctor? And this is, when I give lectures on this, I talk to the students about it. When you go to the doctor and the doctor says, eat healthy,
What's
what does that
that?
mean?
What
Yeah,
does
like, what is that? But they'll say that, like, hey, your
that?
cholesterol is high, your blood pressure is high, just
Mhm.
eat healthy. But like when you're with an integrative medicine practitioner, like in my practice, we also have a nutritionist,
Right.
right? Because the nutritionist will tailor a plan to you. If you don't like fish, you're not going to eat fish, but you got to eat differently, right? And so that's part of the practice. It's just like knowing what your vitamin deficiencies are. Like, are you not sleeping? A lot of people don't factor in the stress that they have. You mentioned at the beginning from work. But
Mhm.
one of the things that I've seen a lot is how like stress actually impacts your sex hormones. The
Oh,
higher the stress, then your progesterone, estrogen, testosterone starts to go down. This is for men and women. Men will have low testosterone. That can impact fertility. Having low hormones impacts your energy levels. And nobody talks about that, right? And so I'm not doing anything crazy. I'm just addressing all the lifestyle factors.
I think nobody talks about that on the patient end of things, is that they don't think these aspects are that important. Because when you go to the doctor's office, what are you talking about? Whatever is ailing you at that point. Forget that, you just worked 80 hours a week. Forget that you have a child who may have special needs, and, you have a supervisor that is breathing down your neck like, a rabid dog. People don't usually think that all of these things are connected, right? And especially talking about, sex. People don't feel like that is something they have to discuss with their doctor because, oh, the decency of it. No, this is part of your health, right? This is part of your health. In understanding that, stress, working long hours, other things can actually affect your libido, right? Everything is causing that, those good hormones that actually stimulate you to go down. So it doesn't matter, it's not your partner. Sorry, it really isn't.
Yeah.
It's not your partner. It's everything that is going on around you. And just for the purpose of, hi, look, I'm still here. I'm curious to see what your attending would say today if you would, you could reach out and like, hey, thank you. By the way, this is where I am, and this is what I've been able to accomplish. I think that would be a really sweet thing for him to, see how far you've come.
Yeah. And I mean, and the cases are cool. Like they're
Right,
very cool. And I just want to point out one because it's everything we've talked about. I
right,
had that lady, she was in her 40s and she came and she was tired all the time. She had to wake up very early for work and she had 2 kids. Her doctor said, oh, you're tired because of your job and your kids. So we
right.
did an elimination diet, right? And when we did the elimination diet, one of the things that she realized is that every time she drank coffee, it was giving her a lot of anxiety. So she ended up in the long term switching to decaf, right? And how few people would correlate their anxiety to the caffeine that they're drinking, right? So that was the one thing. Then she had irregular periods, and she thought that was because she was going into perimenopause. Me
Right.
too. So we incorporated a journaling and a yoga practice. She was running a lot. She ran like 10 miles at a time. And I was like, listen, you got to cut that down because we got to work on like replenishing and restoring your body. So she didn't run for 3 months. After 7 years of irregular periods, her periods came back regular, right? And she's like, wow, like I never knew this. And then her energy came back. And a year later, she was running like a half marathon and a marathon, and she felt great. But the key here was one, she learned how to eat for her, what she needed. But then she also learned balance, right? Because for some people, exercise, running can be like a coping mechanism for
Mhm.
stress. But what she didn't realize is that she was pouring from an empty cup. So when you incorporate practices like yoga or, maybe rest days, more rest days, you can actually balance and help yourself more. But who would have talked about that? I didn't give her any medications. I didn't give her any hormones. This was all lifestyle.
You're right about, who could have thought it was just basically adjusting a thing here or there. We live in a society that sometimes, we have like this one size fit all approach to things when it comes to diet,
Mm-hmm.
exercise, right? And, if you want to run a half marathon, you must run however many hours in a given day to train your body. What if my body is not, right now foundationally firm to do that? And that's the great example, pouring from an empty cup, right? Maybe the person is running, 6 to 7 hours in a given 24-hour period, does not have the stress at work like I do, may not have children, or may have a trust fund that they don't have to work, right? So it's this thing that, yes, we mean well to be healthy, but we often just go into things blindly, even with fad diets, right? At
Mm-hmm.
a point, oh my goodness, keto. Another point was gluten free, but it wasn't for everybody. It's not for everybody, right? So we tend to have a herd mentality sometimes when it
Yeah.
comes to those things. And you have to tailor things to your DNA. You have to tailor things to your situation. You have to tailor things to who you are and what you have going on in life. So this is really great education for anybody listening. I know you may be trying, but it's good to kind of get down to the nitty gritty. Talk about everything. Talk about everything. Nothing is off the table. So
Yeah, and the other thing is like there should be no shame around anything medical because people will be like embarrassed and I'm like, okay, whatever you have to say, I've heard and seen worse than this, right? And it's like I'm not going to I don't judge or think like, oh, what a weirdo. It is what it is, right? If you want to talk to me about like your sex life or what's going on at home with your kids or I've had patients who are like, man, I can't stand my kids or my husband this week, and it's just like it's life, it's normal, right? It's okay to go through phases. You're not a horrible person for thinking the things that you do. Like we're all just trying to do the best we can, right? And sometimes you're just like not your best self because
right,
like I said at the beginning, you just don't have the energy to do these things. And I like what you said about not having protocols. I think it's interesting, some people online, influencers will like try to sell a protocol and it'll be like, buy this protocol and like lose this much weight. But from what I've seen and done in my practice, I always think it would be so easy if I could find the protocol that I could just sell online, right? It'll make me money and make people happy. But the thing is like every patient that I have is so different that I
yes,
haven't been able to find like, oh, this is it. This is the answer for everybody. So I like that you said that and you pointed that out because if your doctor or whoever you go to says, hey, listen, this is my protocol, follow it without taking into account, like you said, are you able to exercise? How much are you able to exercise? I have patients that for them starting out exercise means that
right,
they're walking on the treadmill, right? So then it's just like you have to like take account and take people where they're at. And I think that that's something that we kind of forget. And the other thing is, if you go to the doctor and you have high blood pressure, you have high cholesterol, whatever it is, I think that it's a mistake for doctors not to have a conversation and to ask why, right? Like, why is your blood pressure high? Like, is there something going on? Because high blood pressure can be an emotional thing, right? Like if you're under high stress, or
right,
is it like your diet? Like, this is something that we have to start having conversations like, why? I always want to know why. Why is your cholesterol high? Why are you tired all the time? What does your lifestyle look like? Are you eating or skipping meals all the time? Like, why? Right. And I think that that's something that we have to start asking. If you go to the doctor and he wants to put you on a pill, why? What's the underlying thing that's going on? But not everybody is willing to do something about it. So that's the other thing that you just have to, and that's why I say accept things and you have to meet the patient where they are. Because I have patients where like, I just want the pill,
right,
right? Like, I don't want to think about it. And that's
right.
okay, right? But like, you have to have the conversation first.
Right. So that I think that sets you apart as a provider, right? Because again, not everybody practices the same. I've worked with great doctors. I've worked with great nurse practitioners. I've worked with great PAs. I've worked with not so great ones, right? Where,
Mm-hmm.
okay, this is the thing. This is what I have. This is the time that I have with this patient. Oh, okay, everything is fine. You're great. Okay, cool. I see your A1C. It's not budging. So actually, you know what? It actually increased. So what we're going to do is that we're going to increase the insulin. Da 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 da. Great. Okay, I'll see you in 3 months, right? So it keeps things easier. It makes everything. Are you okay? Yes, I'm okay. That's all I need to hear. You said you're fine. I'll take it at your word, right? And the other part is the shame thing that you mentioned, because I was going to actually have a follow up question. Why do you think people feel shame? It's because sometimes is that saying is not what you say, is how you say it. Some people feel like almost the questions are not open ended, they're close ended and almost judgmental, right? When a doctor is questioning as in what is going on. Didn't I tell you to stick to your diet? Didn't I tell you to, be compliant with your medication? So life happens, we're human. Things happen. People are going to fall off and get back on. If I can champion a patient to get back on, I think that is my job as a nurse, as an advocate, as whatever I find my position with that patient. However, not everybody gets that. And for somebody to feel shame, something happened along the way, right? To make them feel reserved, that shame to say something. What do you think that we can do as people in the healthcare space, as providers, to not be the reason somebody feels shame in opening up about what is really going on with them?
For me, I get curious, right? Instead of being like, oh, why did this happen? Like what's going on at home, right? Like, do you not have time to meal prep? Are you having a stressful situation? Like I start asking like life questions, right? Are you under a lot of stress? I think that when you get curious and in a genuine way, right? Not like what's going on at home, but like, hey, like, can you, like open up, like what's going on? You invite that person to like open up and share. And, sometimes I'll share like, hey, yeah, like I remember, when I was coming off of birth control, this and this happened and it was really, really stressful for me. Like, have you found that, your experience X, Y, and Z, kind of like make it relatable. But I think the most important thing is get curious. And I understand that doctors don't have time. Like my appointments are 30 to 60 minutes because I want to make sure that I have time with my patients. But I mean, I think even if you only have 5 minutes,
that is rare.
Yeah, I cannot. I have tried to have 15-minute appointments. I cannot. I don't even know. Like I was always running behind, right? Like, so I just decided I would see less patients, but give myself the time because I want to make sure that every person feels heard. But if you don't have time, I still think that you can ask questions. And especially when it comes to someone who's not compliant with medications, from working in the hospital, I can tell you that like at least half of the time it was a resource issue, right? Like they couldn't get the medication. We are prescribing a medication and maybe it was too expensive. And sometimes people have to decide whether they're going to buy their medications or they're going to do groceries. Like that's a real thing.
Absolutely.
Right. But then you're just like, oh, I prescribed it. You didn't take it. But like, if you got curious and be like, hey, like, what's the barrier here? I think you'd find out a lot of information and maybe be even able to help more, right? If you just got curious.
Absolutely. And you just, oh my goodness, you hit the nail right on the head with that one, because there's this assumption, and I don't know where it comes from. I don't want to call it arrogance because it's not. Maybe it has a little hint of arrogance in it. It's that us as humans, sometimes we struggle with putting ourselves in other people's shoes. We feel like because we have the resources to do things, everybody should have the resources. You should know how important this is to you. It's for your life. You should take the medicine. But it's literally what you said. It's between buying this medication because either my premium doesn't cover it at all or cover it in full, or either feed my kids, keep the light on, have the other half of my rent paid. Like it's usually something, or understanding, which is like the language barrier and the resources that we have for bridging that language barrier in healthcare. It's 2024 going into 2025. We've got to do better a little bit. Oftentimes, because a doctor only has 15 minutes with a patient, the language line takes about 30 to 45 minutes to have a 15-minute conversation. So it often leads to, okay, I'm explaining this to you in English, right? Okay. And poor patients who don't understand politely says, okay, right? Yes, okay. And then they leave. We miss the opportunity of pulling in the other interdisciplinary team members, social work, case managers, right? The people that can actually help somebody secure the resources or have the conversation that you don't have time for. Which brings me to my next question. Did you find that pulling in like social work, case management nurses, and other resources in the hospital or even in the community actually did help with supporting somebody?
Yeah, I mean, I told you in our first call, like case managers are my favorite people in the hospital, because if the case manager doesn't know what to do, then like you got to change your plan. Yeah, no, you change your plan and you make it work because one of the best hospitals that I worked at, they had a discharge lounge, right?
Yeah,
So the case managers were working during the week to like make sure everything was ready for the patient. But when you went to the discharge lounge, all their doctor's appointments were made, right? Because people forget, right? So if they saw the cardiologist, they saw a podiatrist appointment, everything was scheduled for
yeah,
them. So there wouldn't be like a lapse. And then the other thing that the case managers and the discharge lounge were really good at was making sure people can afford their medications. And sometimes they'd call me and be like, hey, like you prescribed, I don't know, Brilinta, but the patient's insurance won't cover it, but it'll cover Plavix.
right.
Okay. So then I would like change it over to Plavix. And I'm like, that is so important because then you're sending this person home who can't afford their Brilinta and they just got a stent placed. And then their stent is going to get occluded because they maybe didn't understand the importance of being on the dual antiplatelets. And I didn't know that their insurance wasn't going to cover it. And like, that is so important, especially the follow-up. Patients being lost to follow-up is one of the most like frustrating things. And I agree with you. Like, it can't really all fall on the doctor because I have no knowledge. When patients start talking to me about like their insurance and like what's going to happen, I'm like, whoa, 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 let me call a case manager. I got you. Let me just call the case manager because I don't know, like I really have no idea. So I rely heavily on the case managers. And I've said it, I'll say it again. I say it to everybody that I meet. Case managers are so underappreciated. I don't think that you can have a hospital that runs without them. Yes, I truly mean that because I think that they are the best advocates for the patients. And they also make my job easier because I know that the patient's being discharged and that they're going to be okay.
Absolutely. Absolutely. And thank you for saying that. As a case manager for so many years, it feels good to hear that. We're connectors. You and I talked about this. We're that, when you have that one person in your life that you need a plumber, you don't quite know who to call. It's like, I have a guy, right? So we're kind of like a buffer. We are the ones, we take the brunt from the patient's family, the patient, the insurance company, the doctors. We're kind of like, we'll take everything, but let's figure this out, okay? I get you upset.
Mm-hmm.
However, I need the service covered, okay? I get that, you're short on drivers, but I kind of like need this DME in the house before my patient gets home. So tell me, when is the latest you can deliver it, right? So it feels really great to hear you say that. And it feels even... It is wonderful to work with doctors that understand that they don't know everything. I
Mm-hmm.
love that. Right? Let me help you. I'm here. Right? Let me figure out the part that you don't know. You focus on being great. You focus on being the best doctor ever. When it comes to the community connection and everything, to make sure that this person is not lost to follow up, this person does not have an under 30 days rehospitalization, which is not a good thing, right?
Right.
That this patient is well taken care of. They understand their plan. They know what to do. They know what the treatment regimen is. Pull people in, right? So this is why it's so great to work with a team of people that, value each other and support one another. Do you feel like that is something that you've experienced, not just with case managers, but we make the world go round. But is that something that you feel like you've seen, like when a team is supportive of each other, like patient care goes smoothly?
Patient care goes up, and I'll say, like, personally, my job satisfaction goes up, right? Because we did go in this to help people, right? And so it's so frustrating when you're like trying to find resources and you don't know what to do. I think so, like, my work satisfaction goes up and my stress goes down, right? Because like I don't have to do it all on my own or like try to figure it out on my own. So I think that that's like really important. Like you said, a hospital there's so many moving parts when it comes to like what's going on with a patient. I don't think people who are patients realize how much is actually going on behind the scenes, but it does take a lot. And I don't think that you can do that without patient care. Like I'm with a patient for 15 minutes. The nurse is my eyes throughout the day. I'm depending on the nurse to tell me like, hey, like something's wrong or like this is happening so that I know, how to pivot. I'm depending on the case managers to help me with the discharge plan. Like everyone has to work together. So I do love, that you just said how everybody needs to be together because I don't think it's like I've never felt like it's a hierarchy thing. Like, oh, like I'm a doctor, do what I say. Because really like sometimes the case manager has to tell me like, hey, like this isn't a good discharge plan. And maybe like I didn't realize that the patient was homeless, or maybe like they had no water running in their house or whatever it may be. Like these things happen, right? Because I didn't have the time to sit down with the patient, but thanks to the case manager who sat down with the patient, now I know that like my discharge plan has to be a little bit different.
Right.
So it's very important to be able to work together.
Right. So yeah, the hierarchy thing, the doctors, and it's not just me saying it, it's very evident. People who have that mindset are usually not the best, the most successful in making sure their patients are discharged safely and the patients are in the community safely. We have to listen to each other. We have to talk to each other. We have to work together. We covered a lot, and this is to be continued, right? And just to round this conversation up, something you said that it is a big thing that we will continue, but I want to kind of like conclude this conversation with that. When it comes to our practice in healthcare is very much heavy on evidence-based, right? We are in a very heavy evidence-based practice climate, I should say. So with integrative medicine and, the benefits of it, in conjunction to modern medicine, what do you hope to see in the next few years? Be it practitioners like you that are active in this arena, to report their results or to communicate what is going on. Like, what are you looking to see?
Well, I would like to see more of a balance and like maybe the doctors, right? Like traditional doctors working with the integrative medicine practitioner, because I think that that's important. I also think that it would be beneficial because there are studies on like certain herbals and certain things for, the traditional medical community to start learning, or maybe just that information to be out there. Because I think that one of the things is that some patients don't feel like they can tell their traditional doctors like, hey, I'm taking this herb for this or whatever, because they think the doctor is going to like ridicule them or be like, oh, that doesn't work. But, if there's more education on these things, then it'll be easier for me to work with these doctors, but the patient will have like a more well-rounded care. I try to make it a point to stay in touch with other people's like traditional doctors so that everybody kind of knows what's going on, and also so they understand what I'm trying to accomplish. But I think it has to be, just like you said, multidisciplinary approach. And I think that we need to be able to work together. And I think it's happening slowly. I think that's happening, but I would like to see more of that. And I would say that that's mainly it.
So would you like to see more connection and more community kind of connection among doctors in general? Right. So this is why I don't want to ask this question, because each ecosystem is very different, right? The doctors that practice in a community practice is very different from a doctor that is wholly in a hospital, because the hospital has its own little village and the communities have their own little village. So for the purpose of sharing information, right, and having that evidence to show that each practitioner in their different areas of expertise, like your focus is women's health. Granted, you're an internal medicine doctor, right? Helping women understand their hormones, how to balance their hormones, using lifestyle, using an integrative approach, right? With another person that may be using, say, energy healing or oriental medicine, right? Would you like to see an integration of a community that connects all these specialists and providers, where the hospital can also have them as a resource? Because a hospital doctor is not going to reach out on its own. It's always going to be kind of like a collective thing, because that's just how hospitals are set up, right? Would you like to see that, for the purpose of, having evidence and having people recognize that the providers within their community that can actually help them stay healthier?
I mean, I think that people want that, so I think the people are going to make that happen. I will say that I think, so integrative practices are very common, and I see it here at Sarasota Memorial within the palliative care and cancer center, right? Because they have integrative medicine there. And I think it's, very great for those patients. But I think that, like you said, it would be great to see that scope widen to patients, who are not cancer patients or needing palliative care. I would like to see that expand. And I do think that it is important. Anything that you're doing with a patient, it should be community-based. Like when my patients see an acupuncturist or a massage therapist, like if something's going on with the patient, like we're communicating about that. So I do think that anything that you do with the patient should be community-based. So it would be great if you had everything in one place. One, because then all the documentation is one place and you can keep in touch and know like what's going on with the patient. But also I think the patient would have a better experience if this was something that you can do in a place like that.
Absolutely. I agree. I absolutely agree. I think the more we come together, the better our patient outcome would be.
And I think like over the long run, like doing things in that way in the long run would decrease healthcare costs.
Oh, absolutely. Absolutely. We're talking patient-centered, patient-focused, but the other end of patient-centered, patient-focused is cost saving, right?
Mm-hmm.
That's the other end of it, right? Whether we want to talk about it openly or not, hospitals are hemorrhaging fiscally,
Yes.
right? Because if somebody is not well managed, guess what? It affects reimbursement rate, right?
Yep.
So if I have a diabetic that I cannot control their A1C and they're consistently coming to your appointment, I'm consistently prescribing insurance and consistently paying for the therapies or whatever, if that person is not managed enough that they become a super user on the insurance end of things, it's going to not look good for the hospital, right? So on the other end of things, the fiscal earning and saving, cost saving when it comes to managing patients. Yes, we established to help people get healthier and live healthier lives. On the other hand, when people are healthier, bank accounts get healthier. Just saying. Yes. I don't know much, but... So final word for women. Women, what should you know? How should you pay attention to yourself? What is that gut feeling? So every woman who's listening can, take note.
Like I said, I'll just reiterate, if you feel like something's wrong, then it probably is, right? Women have a great intuition, and I think that you need to listen to that. I think that you need to be able to have a conversation with your doctor. And if you feel like you're being dismissed, like I said, you can look at the Institute of Functional Medicine or Integrative Medicine website and try to find a practitioner. But I've seen way too many times where women were actually right about something and it was dismissed. And I think that that is really unfortunate. So again, listen to your intuition. And then the other thing I will say is don't make it complicated. Sometimes I have to tell my patients like, hey, like it all goes down to the basics, right? Like they're wanting like supplements and like these crazy, like, what can you give me? And sometimes it's as easy as like, are you sleeping enough? Like, what are you eating? So start paying attention to the basics, because if you're not sleeping, moving your body, if you're not eating correctly, like nothing else that you take or do is going to matter. So you need to take care of yourself, which I know as women is a hard thing, especially if you're a mom and you have a family, right? Like that's a hard thing. But I would say that you have to just go back to the basics, right? Find a way to do that, or work with a practitioner that can kind of help you find the balance.
All right. Thank you. Thank you, Dr. Victoria Andarcia. Thank you, everybody, for listening. We are looking to have more of episodes like this, and I will try to fix myself into Dr. Victoria's schedule again, because there are a lot of gems that I don't think we got time to talk about today. And please let us know what you think. Was this beneficial? And in the show notes, we will include all of Dr. Victoria Andarcia's information, her practice, and whatever tools that she has that can be helpful. So whoever wants to reach out to her, work with her, inquire, please feel free to do so. We want a healthier society, so do your best, do your bit to be healthy. It will pay off in the long run. I'm on that, journey. Is not the easiest. However, I am starting to recognize, those things that contribute to the general imbalances that happen. So thank you, Dr. Victoria. It was great having you.
Thank you. I loved our conversation.
Thank you. All right. Bye, everybody.
Thanks for tuning in to Unshelling Medicine podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.